We call upon Sophie Mokoena from South Africa BC, SABC. Sophie, please unmute yourself.
My question is around vaccine access, particularly to the developing South or poorer countries. The issue of passport, vaccine passport, is becoming more popular, and many people are looking at using that to ensure that they are able to manage the spread of COVID-19. What is the position of the WHO on this vaccine passport and also travel restrictions? And it's linked also to perhaps naming viruses on countries where they are being detected. I mean, the issue of 501YV2 is still being called a South African virus by even very senior experts in science like Dr. Faki of the United States of America. And is this not stigmatizing a country that has done so much to try and contribute?
Thank you very much, Sophie. Dr. van Kerkhoff, please.
Thanks, Sophie. I could start with the second part of your question. I think you know I've been on record of talking about the naming of these virus variants, and WHO for years has been talking about not including a location as part of a name of a virus or a disease or a pathogen or the disease caused by that pathogen. And SARS-CoV-2 variants are no different. We continue to see people name the variants country X variant or country Y variant, and we have been working hard actually on developing a nomenclature with a large group of scientists around the world, including the 3 groups that have developed different nomenclatures for the viruses. I have to say, I have to admit, I foolishly thought this would be a very simple thing to do. I thought it could be done in a week or 2, and we're now into our second month of doing this. We hope to be able to announce the nomenclature very soon because we need to make sure that any of the names that are used do not further stigmatize a person or a last name or a location inadvertently. And so we're still working on that, but we do hope that countries do not say the South African variant, including scientists. Unfortunately, I hear that on many teleconferences that I'm on, and we spend a lot of time talking about these virus variants that are being detected around the world. The more you look, the more you will find. And with the increases in genomic sequencing that are happening worldwide, there are a lot of regional platforms that are being enhanced to make sure that we can find different mutations and different virus variants. There are a lot of research groups that are out there that are studying each of these mutations and the combinations of mutations, which are what these variants are, to determine if there are any changes in transmissibility and severity and any potential impact on our available and future diagnostics, therapeutics, and vaccines. So it is really important that we do have names of these virus variants. Right now, what we're using is the B117, the virus variant first identified in the United Kingdom, the B1351, the virus variant that was first identified in South Africa, and the P1, which is the virus variant that was first detected in Japan but is circulating in Brazil. But there should be no stigma associated with these viruses being detected. And unfortunately, we still see that happening. Countries that are conducting surveillance, that are carrying out sequencing, that are sharing those sequences on publicly available platforms, that are working with WHO and scientists around the world should not be stigmatized for sharing this information. In fact, we need more of this to be happening worldwide, and we will continue to work with partners to ensure that that happens.
And Dr. Ryan, please.
Just on your question regarding certification of vaccination, WHO does support certification of vaccination, be it paper or electronic, as a means of providing personal health information to people who are vaccinated and to give them a record of that vaccination, but also for monitoring and evaluation purposes and quality assurance purposes in the health system. So having proper certification and recording of vaccination is very important. That's a different consideration to what those certificates are used for outside the health space, and that would be health certification of vaccination being used to attend work, to attend school, to attend events, to travel nationally or internationally. They are not necessarily related to the health of the individual, but to other factors. And this is a complex issue. It has both considerations around how such certification could be utilised to reduce transmission, but also around knowledge around the impact of vaccination itself and the way in which vaccination may or may not prevent transmission. And there are ethical issues here regarding equity. We already have a huge issue with vaccine equity in the world. The imposition of requirements for certification of vaccination before travel could introduce another layer of such inequity. If you don't have access to vaccine in a country, then you effectively become isolated as a country as vaccine passports kick in. So there are many, many, many issues. Currently, WHO, or through the Emergency Committee of the International Health Regulations, have made temporary recommendations to the Director General that proof of vaccination should not be a requirement, be required for the purposes of international travel. That group will meet again, I believe, on the 15th of April, and I'm sure that recommendation will be under consideration. In the meantime, we are bringing together our Strategic and Technical Advisory Group on Infectious Hazards with the Strategic Advisory Group on Immunisation and the Ethics Advisory Group of WHO together to look at these issues, and currently we have an internal working group really pulling together both the scientific data, social data, the ethical data, so we can come and get the best possible external advice in order to advise our member states regarding the use of and potential use of vaccine passports, as you call them. Thank you.
Thank you very much. And for the last question, we go to Robin Mia from AFP. Robin, please unmute yourself.
No, thank you. Can you hear me?
Yes, go ahead.
Thank you. Within the European Union, some countries like Spain and Germany have relatively low rates of new infections, whilst other countries like Poland and Estonia and Hungary have seen some of the highest rates in the world. So my question is, in big areas, like, say, Brazil, or in this case, the European Union, would it make sense to divert vaccines away from areas of low infection and concentrate on areas of high infection to tackle the fire where it's burning most strongly? Thank you.
Thank you very much, Romain. Dr. Simao, please.
Let me start, and then colleagues can complement. I think it's very important, Robin, to clarify that vaccines are not necessarily a good response to an acute problem, right? Because vaccines take time to reach immunity and everything else. So it's extremely important that when you have a lot of community transmission, like we're seeing in some of these countries, that what we call the public health measures are taken into account and they are strictly followed. And these are the mask, consistent use of mask, hand hygiene, ventilation, avoiding crowded crowds, and in some specific cases even lockdowns, and as we are seeing in Europe. So we have discussed last year what would be the role in whether we should have a buffer for emergency response related to spikes in transmission. And the decision that we did collectively last year was not to do that at this stage, because, like I said, vaccines are not a good response for immediate situations. What you need in the case of high transmission in the community is to decrease the possibilities of transmission. That means that decreasing, to avoid that people get in touch with each other and avoid crowds and everything else. So, and also there is a very, let's say, it's from the epidemiology perspective, no one can predict where it's going to be rising next, right? We are seeing that even countries that have reached a higher vaccination already, we are seeing peaks in communities and peaks in cities and provinces. So it's very difficult to predict what's going to happen next, where the next surge will come. So I think the approach right now is that we're pushing for equitable access to vaccines, and that we are pushing, as was discussed already today, to ensure that people at high risk of infection, or people like we mentioned, was mentioned before, the healthcare workers, and also people at higher risk of dying, older people and people with comorbidities, associated diseases, that they are put first. And we think this should happen, that WHO's position that this should happen in all countries, not on specific countries only. Thank you.
Thank you very much for this. We're coming to the close. Oh, no, we have an add-on from Dr. Van Kerkhove.
Yeah, sorry, thank you. I do want to come in on this because I think we need to remind everybody that vaccination is one element of the response strategy. And as Mariangela has said, as you have heard us say repeatedly over and over again, we are accused often of being a broken record, and we will be happy to continue to be this broken record until this pandemic is over. But there are a number of elements, interventions that can be used that drive down transmission. Globally, we have passed the 6th week in a row where we have seen a consecutive increase in cases around the world. Last week, there were 4 million new cases reported to WHO, and that is likely an underestimate of the true infections that have been occurring globally. We are seeing this in all of our regions. There's a slight decline in Europe, but there are still significant increases in a number of countries like France, Turkey, Italy, Ukraine. The U.S. continues to have increased transmission. The Americas continues to have an increased transmission driven by Brazil, Canada, Argentina, Colombia, the U.S., the same thing in Southeast Asia, a number of countries. We can go on and on. All of this data is in our dashboard, but we continue to see increases in transmission, and we have to remind everyone that there are a number of interventions. This is the tried and true measures, these public health measures that drive transmission down. It's this all of government, all of society approach. It's about knowing where the virus is circulating, so having good strategic testing linked to public health action, ensuring that cases are isolated, that they receive appropriate care. It's contact tracing of contacts of known cases that are in supported quarantine so that they, if they are infected, do not have the possibility to transmit the virus onward. It's about getting into the clinical care pathway early so that individuals who are infected with the SARS-CoV-2 virus are seen and are assessed so that they are treated appropriately and that they are cared for appropriately. It is making sure that we have engaged, informed, empowered communities so that they know what they need to do. We understand that the situation is evolving. The situation where you live changes. So following guidance and following the local recommendations is really important. There is very good information that is out there that tells you in the area where you live, in the area where you work, what is safe to do and what is not. At an individual level, it's about physical distancing. It's about wearing a mask. It's about practicing respiratory etiquette, making sure you have clean hands, making sure that you have good ventilation, you avoid crowded areas. All of this matters. This will not change until this pandemic is over. So we cannot rely all on vaccines and vaccinations. We have to continue to put in the individual level measures. We need communities that are supported. If there is a stay-at-home measure in place, we need governments to support individuals to be at home. All of this still matters. So we will continue to be this broken record and remind the world that there is a strategy out there about suppressing transmission. This guidance, this strategy was issued on the 4th of January last year, and it still is the maintained strategy of what we have now to drive transmission down, adding vaccines and vaccination into the mix so that we keep transmission low and we open up our societies. So we cannot forget that there are a number of measures that are in place that we have the power to use now.
Thank you so much for this, and thank you all for your participation, especially our special guests. We will be sending the audio files right after this, and we hope to include the speech of the President of Namibia. With this, let me hand over to Dr. Tedros.
Christian, can I just come in, because it's just just an update on a previous question regarding ivermectin, and
of course,
just to confirm that ivermectin is not currently included in the Solidarity trial, but there are trials ongoing in other countries. The latest recommendations from WHO indicate that the evidence on the use of ivermectin is not conclusive, and further studies are recommended, particularly in large-scale randomised controlled trials. With regard to the process within the Solidarity trial, an independent panel of experts uses a set of defined criteria to pre-select potential drugs into the trial. A prioritisation working group then reviews the panel of experts' recommendations, and then finally what gets through that group goes to the trial steering committee, who then endorse those recommendations and introduce those drugs into the trial. So there are 3 different independent panels of experts who filter all the potential drugs. There's a series of criteria that are used around pharmacokinetics, plausible evidence on the mechanism of action, animal data, safety data, availability of the drug, and currently a number of drugs are under consideration for the trial, including 3 new drugs. And we've been really trying to get to this, is moving not away from old drugs, because old drugs as we've seen, like dexamethasone, have proved life-saving, but really beginning to test the newer molecules and drugs that are coming online. So we look forward to the next selection of drugs for the Solidarity trial.
Thank you so much, Dr. Ryan. This was in clarification for a question from DIVEX. Now with this, let me hand over to the Director General for closing remarks and for thanking the guests.
Yeah, thank you. Thank you very much. So I would like to invite Her Excellency Prime Minister Motley to say a few words for closing this session. Your Excellency, you have the floor.
Thank you very much, Dr. Tedros. I was very engaged during the course of questioning. This is very much still a fluid event for all of us in the world, but it is one that really has the capacity to upend developing countries, and we need to ensure that as we fight the pandemic, we also put down the tools to avert a debt crisis, which is potentially on us if we do not get it right. As I speak to you, the chairman of the Caribbean Community has regrettably tested positive, Prime Minister Keith Rowley, and I know that you have been in contact with him recently, and I would therefore want to express our deepest concerns for his urgent and quick recovery. But this just drives home the point that until we deal with this with all people, we haven't dealt with it. And I trust and pray that these continued works and World Health Day tomorrow will remind us of the urgency for coordinated action and for the urgency of acting together. We look forward to the continued support of WHO and PAHO, particularly for those countries who have limitations in terms of the depth of technical resources, and it is for that we continue to pray that we have access, because that makes all of the difference to people living. We heard very clearly that global transmission has increased over the last 6 weeks, and to that extent, we continue to remind persons that there is no mechanism at the individual level that is too much to protect your lives, from the personal protocols right back through to what we will do at the global level and at the national level to give people access to vaccines ahead of time, ahead of the battle with the variants. So thank you very much, Dr. Tedros, and I look forward to continuing to work with the World Health Organization and PAHO as we come on top and win this battle against COVID-19 that has done so much to decimate so many. The tail of it, regrettably, is long, and we work towards ensuring that we can reduce the consequences of that tail on our people as well. Thank you.
Thank you so much, Your Excellency. I fully agree with what you said, and also I join you in expressing my, wishes for fast recovery to His Excellency Prime Minister Rowley. I would also like to thank all heads of states who have joined today, His Excellency President Gain Gob, His Excellency President Alvarado, and also His Excellency President Aliyev. Thank you so much once more, and thank you so much for your leadership. Finally, tomorrow we will publish an additional short list of films for the Health for All Film Festival. This fourth shortlist is dedicated to health equity. I invite the public to post questions in the comment section of the shortlisted videos, which are available on YouTube and through the WHO website. Some of your questions will be asked to the jurors and winners during the award ceremonies, to be streamed on WHO's YouTube channel on 13th May 2021. Thank you to all journalists also, finally, for joining, and see you in our upcoming presser. Thank you so much.
All right, we thank you so much, and we will be there. We're just going to take a break now. We'll be back until we wrap up the program at the top of the hour, so stay right there.